You're listening to Transformation at Work, your one-stop guide to Salesforce success. And this is Jarrett 411, your up-to-the-minute source on the latest breaking news and developing trends in and beyond the Salesforce ecosystem. From macroeconomic events to implementation questions, legislative changes, and more, our team of experts are here to provide the updates you and your business need to thrive in a constantly evolving industry landscape. Today I want to tell you the same story from two different perspectives. First, that of a healthcare payer. This payer gets a request from a member. That member's doctor is recommending a procedure. Now, from the payer's perspective, there are a lot of questions that need to be addressed before they can sign off on this request. It's a costly procedure. They need to confirm that other avenues potentially have been pursued before going for this test. They want to save money, yes, but they also want to make sure that their members' resources aren't being wasted on unnecessary procedures, and that that money is going towards the best possible uses to give them the highest quality of care possible. That approval takes time, but it's time spent making sure that that procedure is the best possible course of action. And now I want to tell you the same story from the member's perspective. This is someone who is sick. Their illness is impacting their work, it's impacting their family life, and quite frankly, they want it figured out and want it figured out now. If getting this test done is going to be the thing that tells them how they can get back to their day-to-day life, well then, they're going to want this test done. And the time spent waiting for approvals to come in or figuring out a new course of action when approval doesn't come in, that's time they've spent in a painful position. Now, these are both completely understandable points of view that are, unfortunately, oftentimes completely at odds with one another. And it is that tension between those viewpoints, the frustration caused by a lack of transparency, long waiting times, uncertain outcomes, that has led to several proposed changes labeled CMS 0057 set to roll out in 2026 that could massively overhaul the prior authorization process. Now, these changes are proposed and they're still a ways out, but even so, if payers aren't putting in the groundwork to potentially address them now, that time is going to catch up on you pretty quickly. And when it does, the sheer number and complexity of prior authorization requests means that payers might be in a disastrous position when they need to address these on the fly. And that is why it is so important to understand what these proposed changes are, how to put the groundwork in place to meaningfully address them ahead of time, and the role that digital tools can potentially play in helping streamline the complex process of prior authorizations. To help us truly dig into this topic in this episode, we're sitting down with Cheryl Gibson, Jarrett's Senior Director of Healthcare and Life Sciences for Payers. Now, Cheryl has almost 3 decades of healthcare experience working with some of the largest payer organizations, the last 10 of which spent specifically working to implement and deploy Salesforce within some of these organizations. That experience has given her really incredible insights into the pain points that payers face, as well as the way that technology can help them address those issues and get ahead of potential rapid changes in the marketplace. We begin our conversation by surveying the lay of the land and looking at exactly what the prior authorization process looks like at the current moment. Let's throw it over to Cheryl.
Prior authorizations, again, are typically required for services such as inpatient, outpatient hospital services, imaging tests that people are familiar with, MRIs, MRAs, PET scans, home health and skilled nursing, some higher cost brand name drugs. And it can also apply to benefits that have limits, such as physical therapy, speech, and occupational therapy. Obviously, this is not a complete list, but this gives you an idea of the volume. But today's process typically begins with the provider submitting a request, and that can come through channels such as phone, fax, email, or a provider portal. The utilization management team, which is at the payer, will intake the request. And from there, really several things can take place. One is the automatic approval based on the service and the information provided by the provider, and also the seniority or skill level of the person reviewing. The second could be the payer may go back to the provider if additional information is needed and if the request is lacking sufficient detail. The prior authorization request may require approval from a medical doctor, which tends to lead to what's called a peer-to-peer review, which may be necessary if the payer's doctor needs to speak to the patient's doctor about the request. After all of that is done and a final determination is made, both the provider and member are made aware. A lot of times that could be a letter to the member, could be an email or a fax back to the provider. And then one critical point to bring up, because you wouldn't want to miss this, the claim system is also updated with the status. So that way, when the claim is received by the health plan for that particular service, it can go ahead and be paid if the authorization was approved, or subsequently it would be denied based on the status of the authorization.
Now, when laid out like that, the process is fairly straightforward. But when you look at it from the member's perspective, you start to see where some of that frustration comes from that ultimately leads to calls to overhaul the entire prior authorization process. Here's Cheryl with a breakdown of what that looks like.
It's a lot of unknown. First of all, a lot of these more expensive tests, they're probably already a little anxious with what their diagnosis could be based on this test. They know they need it. The provider has told them. And from their perspective, really, the insurance company shouldn't even question it in their mind. So a lot of times tests will be scheduled, and it may even be to the very last point, that day of the procedure, where the member finds out if it's approved or not approved. I've even heard of people, they're driving on the way to the appointment, and they may hear that the test was denied. Unfortunately, with the member and the patient not knowing all the details and back and forth and what's required, their feeling is more about anxiousness related to, okay, what steps do I go from here if it's denied? Obviously this is critical for myself or a family member. So it's really tough on the patient.
And when you factor in the urgency of a lot of the procedures that require prior authorization, you really start to understand members' perspectives when they call for an overhaul of the process. Here's Cheryl.
Particularly in the case of imaging tests, MRIs and MRAs and CAT scans, a lot of times those tests are done and performed to indicate a particular diagnosis, do some exploratory to see why a member or patient is experiencing certain health issues. And so those tests in particular are very timely because a doctor may be hinging upon particular treatment based on the results of those tests. So I would say probably out of all the items that need prior authorization, that's one of the most time sensitive.
And everything that we've covered so far, the wait times, the lack of transparency, the frustration that comes with denials, these are only a few of the many points of frustration that exist between payers, members, and providers when it comes to the prior authorization process. Let's throw it over to Cheryl with a breakdown of a few more.
One is really, it's just an extremely time-consuming process for both providers and payers. From a provider standpoint, they may have, folks within their office to go ahead and submit that particular authorization, but there may be a lot of legwork they need to do or attach documentation. And also from the payer perspective, they're looking at, is this benefit covered under the member's plan? So they may have to do some digging on their side as well to determine, if it meets medical necessity. So that leads us to the turnaround time, which is really the tremendous challenge. And the delays and back and forth between provider and payer can lead to delays in patient treatment, just like what we spoke about just a few minutes ago, in that, a critical test may await, confirmation of an authorization approval, and that test may have to be rescheduled. The lack of transparency with the provider and the member as to the status of the authorization request can be an issue. It's not always immediate, specifically from the member's perspective, and there's not necessarily an automation in which a provider and member are immediately notified. I would add to that there's not always complete transparency to when an authorization is denied. All the information and details may not be sent to the provider, so that also could cause concern. And then also the lack of transparency as to which services require prior authorization. So depending on the health plan, depending on the member's benefits, what particular services require authorizations and what do not, that also isn't always 100% clear.
Which brings us to CMS 0057, proposed guidelines that potentially massively overhaul the requirements associated with prior authorization for payers. Here's Cheryl with a breakdown of exactly what the guidelines currently call for and what payers could potentially expect in the very near future.
In terms of the ruling, the anticipated effective date is 2026. Obviously, there has been a lot of, different exchange of opinions, from providers and payers regarding this. I think everyone feels that, yes, it needs to be automated. Yes, it needs to be fixed, but there's varying opinions as to how to fix it. But yes, let's unpack kind of the highlights of the proposed rule as they stand today, which of course, could change in the future. The first is that CMS is recommending that payers use what's called the Fast Healthcare Interoperability Resources, FHIR for short, including prior authorization requirements, documentation, and also the decision API. By utilizing these resources, payers and providers will be able to facilitate digital information requests and automate the prior authorization process. Now, just to add a little bit more detail to that, because I know that's a lot of verbiage right there, this would be data being pulled from the electronic health record or the EHR, and we'll talk about that a little bit further in the discussion, but that's really kind of a lot of those pieces would be pulled as part of that. Payers must provide transparency on the status of the prior authorization request. So it's critical that immediacy of the status, and if it is a denial or if it's on hold pending additional information, that is a quick response back to the provider so that they can move forward, and that the payers must provide a specific reason for the denial. The payers must shorten turnaround times for prior authorization decisions. An example that was given is surrounding Medicare Advantage or also Medicaid managed care, where they're expected to reduce the current response time by 50%. So for example, today it's 14 calendar days that authorization verdict would need to take place within 7. And then the payers must disclose a list of services requiring prior authorization and specific aggregated metrics on their website. So this is something new, right, in terms of providing metrics on their website for things like, what are the percentage of prior authorizations approved, denied, approved after appeal, as well as average turnaround time. They've never had to provide that in a public website before. Obviously, a lot of payers, I'm sure, are keeping track of that level of detail, but that level of transparency is what, CMS is really asking for.
Now, even though these are proposed changes that wouldn't potentially go into effect until 2026, even thinking about what could come to pass, you start to see some pretty hefty potential for pain points that payers might run into. Here's Cheryl with a few examples.
And, unfortunately, payers, can't leap from, fax submissions to fully digital authorizations overnight. It would be great to say that they could. But it takes time to implement new digital systems, and not only implement them, but convince people to start using them. If folks are used to using a fax machine, they're used to having those conversations over the phone or via email, this is a change, in their process. So payers really need to start now and make reasonably paced, iterative changes over the next couple of years, which would really put them in a much better place to hit the ground running in 2026. Given the level of process reengineering that we've talked about, change management, is critical for not only the payer, but the providers within their network. One of the items is around technical hurdles. And, there has been tremendous work spearheaded by what's called the Da Vinci Project. And this project works in collaboration with health plans, providers, and healthcare IT organizations. And the Da Vinci Project capitalizes on the use of the EHR data. However, not all services requiring authorizations have been accounted for as of yet within this project. They definitely have it on their roadmap for the future. But the other challenge is there's many different versions of EHRs. So that is something just to keep in mind as we look forward to future solutions. So health plans need to think about as well, if they want to do immediate approval of specific type of authorizations, what is the logic behind that? Because obviously those discussions would need to have taken place prior to setting up the system to allow for that. And then probably one of the most critical ones as well is integrations with both the utilization management and the claims platform, which are critical for this prior authorization work. That can add a lot of complexity to this process.
So the big question remains, how can payers address all of this? After all, there's no turnkey solution that will allow providers to snap their fingers and address all of these guidelines, due in no small part to the fact that the guidelines aren't even fully baked yet. But even with all of that in mind, there are a few key ways the digital tools can be leveraged to help payers make a better prior authorization process that starts to put the groundwork in place for them to truly fall in line with whatever guidelines ultimately come to pass. For a few examples of what that might look like, let's throw it over to Cheryl.
That's where we feel that really Salesforce, particularly the Health Cloud, can offer a lot of opportunity for payers. And, what we're encouraging payers to look at is, like we said, an iterative process. Step one, look to establish a scalable digital foundation, not only for prior authorization reviews, but quite honestly, other day-to-day operations that take place within a payer. Two is to eliminate fax transmissions with provider portals. We're recommending leave the antiquated fax machines behind by building convenient provider portals with Experience Cloud. And what this can do is really provide a self-service interface that creates a standardized submission process. It reduces unnecessary calls and service interactions, enhances provider visibility. It really facilitates a more informed, intuitive, and satisfying experience. And then it promotes other capabilities, such as providers being able to view claims, eligibility review. It also supports re-credentialing efforts, which again are outside of prior authorization, but a critical component. The next step is leveraging workflow automation and integration to accelerate decisioning. And, this is looking at Salesforce's native automation and integration capabilities to facilitate and coordinate review processes. And by using these, payers can improve efficiency and reduce time spent on manual tasks. They can collect data on key metrics. We talked about that earlier in terms of what payers need to put on their website. They can leverage clinical decisioning workflows to make reviewing medical necessity easier and more intuitive. Define workflows to ensure appropriate stakeholders review each request before approval. And lastly, they could look at creating auto approval guidelines based on key criteria, such as, for example, an identification of high trust physicians who consistently receive prior authorization sign-off. And so possibly those particular providers don't need to follow the same process as other providers. So that also is an option.
It's also here where a good relationship with the right technology partner, someone who understands the needs of payers, the intricacies of legislative and guideline changes, and the ways in which digital technology can help to ease the friction that exists between those two elements, can really be a game-changing factor for an organization. Let's hear how Cheryl puts it.
Right. So really the role that a qualified technology partner can play here is with industry experience. And, there's been so much talk about the prior authorization process and, coming from a lot of different venues. I think, having a partner that truly understands the healthcare industry and the part that a payer plays as well as a provider is critical and will understand the work effort involved. And secondly, thought leadership. We can offer up suggestions. Again, every payer is going to be probably a little bit different in where they fall within the continuum of the process. They may still be taking faxes. They may already have a portal and can look at some other options of improvement. So we would love the opportunity to be able to work with those payers, help them prepare a roadmap really to, better position them for the final solution. Because of the significance of prior authorizations, and, we've talked about the importance for not only the payer, but the provider and the member, is let's look at what are some excellent options for a payer. How can we get them to where they need to be to also improve their member experience, as well as their providers within their network?
Regardless of whether you look at it from the member or the payer's perspective, the goal of prior authorizations is ultimately the same. Help members avoid unnecessary procedures, cut down on unnecessary medical costs, and ensure that members are getting the best quality of care possible. When you think about it in those terms, you understand why it's so crucial to get the information right, but also why sharing information transparently and quickly with providers and members is such a vital step in the process. That is ultimately where proposed guidelines such as CMS 0057 are coming from, trying to make the process better for payer and member alike. And it's also why having the right digital tools to automate and streamline the process and share accurate information as quickly as possible is such an important piece of the conversation. This has been Transformation at Work. Thank you once again for listening, and thank you to Cheryl Gibson for some incredible insights and for breaking down this topic so clearly for us on this episode. Transformation at Work is, as always, produced by Jarrett in collaboration with Salesforce. I am Jeff Stormer, your host and producer. If you enjoyed the show, consider leaving us a 5-star review on iTunes or Spotify, or head to jarrett.com to sign up for email updates when we release new episodes. Until next time, thank you again for listening, and we hope to see you again soon.